Would peptides or regenerative orthopedic injections help a patient dealing with shoulder pain from adhesive capsulitis or a frozen shoulder? I share my perspective in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video, as a lot of mine have been recently, is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on this channel. And please remember, this is meant for information and educational purposes. It is in no way medical advice. Here's the question. I have a frozen shoulder. I just started physical therapy. My doctor suggested a cortisone shot to decrease the pain and loosen up the shoulder. I really don't want cortisone. Are there any other injections or treatments that could be helpful? Great question. I think that's very a good way to think about it. This again is not medical advice, but there are things that you potentially think about. And I've done a number of videos on why potentially I'm not a huge cortisone fan. In this case, it's not so much for the pain. What the surgeon or doctor is trying to do is loosen up the capsule, sort of decrease some of the freezing of the capsule, so to speak, so that physical therapy can really kind of stretch that out and get the range of motion back. I've got videos on this channel all about the ins and outs of adhesive capsulitis or frozen shoulder, so definitely check those out. But physical therapy can be very helpful. As far as some of the regenerative orthopedic treatments, I think you're thinking things like PRP or exosomes or stem cells. I am not aware that any of those have been studied specifically for frozen shoulder. Likewise with peptides like a BPC 157. I do think that any of those could be helpful. BPC 157 or other peptides might help with as something that a patient get prescribed by a physician knowledgeable in peptides from a licensed and legitimate compounding pharmacy could potentially be helpful as a treatment a patient gives him or herself to try to decrease pain. How much that might loosen up the capsule and allow range of motion is hard to know, but could potentially be helpful. One of the challenges with frozen shoulders, it's just so painful. People don't want to use it, and then it keeps tightening up. But as part of something with physical therapy, I do think that there potentially is a role for BPC. As far as something like PRP injected by a doctor into the shoulder or exosomes, something like that, as an alternative to steroids, I'm not aware of any studies where you would really be banking on those treatments as in their anti-inflammatory capabilities, more so than in a regenerative stance. And again, I don't know of any studies. I don't know that it necessarily would be harmful. How much that would help as far as getting the motion back and unfreezing the shoulder, so to speak, is what's hard to know. Those are considered experimental, as peptides are, so I'm not necessarily promoting those, but are worth talking to your orthopedic surgeon and just potentially kind of getting a sense of what you think. One thing to know with frozen shoulders is if you give it long enough, if the diagnosis is truly frozen shoulder, eventually that frozen shoulder will thaw, so to speak, and the motion comes back. What potentially the PRP or the exosomes might help is if that frozen shoulder is secondary to another injury, like a rotator cuff tear, it may help with that primary injury. So there's that part of it as well. Okay, I have a free ebook I'd love to share with you. It's called the Arthritis Solution, although the treatments discussed in it really apply to all kinds of orthopedic injuries and conditions. You can get that completely free. Click the link in the description below this video. Also, if you'd like to potentially see me as a patient because maybe you have an orthopedic injury or condition and you want options other than surgery and other than cortisone shots, you can fill out that same contact form and schedule an appointment to see me. Also, I'd love to hear about your experience with your injury. Leave those in the comments below this video. Just to understand, if you leave a question for me in those comments, I can't offer you medical advice, but like here, I might answer your question in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.